Today, I have the pleasure of speaking with Sharna Southan. She is a pregnancy loss practitioner. Welcome, Sharna. I am so happy to have your amazingness with me here today.
Oh, thank you so much. That's a beautiful introduction. Thank you for having me in your space and allowing me to be here today and share everything.
Mhm. Yes, I think there's so many things that we do that are similar to help other lost moms, but we each have our own special little differences. So I'm really excited for my audience to hear what your magic is. So why don't you, if you're willing, begin by telling us about your loss story?
Yeah, so we were trying to conceive for about 5 years. It's not how you're ever told that that part of your life will go. I had sort of every impression of, pregnancy being easy and, you just have sex and you fall pregnant. So I figured by the time I was ready, you know, to undertake sort of that part in my life that it would just happen. And it didn't. And for probably a couple of years we were just like, oh well, we'll just see. It's been like only like a year or 2 years, and we'll just keep like going along. Um And then it got to sort of about the 3-year mark, and then we kind of thought, well, maybe we should see doctors, fertility specialists, like see what, might be possibly contributing to obviously not falling pregnant. Looking back over that time now and knowing what I know now, I had a very, very temperamental hormonal imbalance. And not once did the doctors ever sort of take that into consideration. I, like I said, knowing what I know now, I showed a lot of symptoms and a lot of signs of, things not being right with my hormones. So for the GP and for even the fertility specialist is like, just, take this medication and you'll be okay. It'll kind of be like a shortcut to falling pregnant. And I
Mhm.
was like, awesome. It's what I wanted so much, was to have a child. So I was like, I'll do anything and I'll take a shortcut if that's what it means. Like, I'll take this medication and it'll make me fall pregnant. And it did. Probably, I think maybe about 2 months after the starting the medication, I fell pregnant. But again, I didn't know my body very well. I had been on contraception since I was 13. So I didn't know what it felt like to ovulate. I didn't know what it felt like even to have because my periods were so irregular. I didn't technically know that I had missed it. So I was a bit further along than probably what I would have liked to go and find out that I was pregnant. But we went to the GP and she confirmed that we were pregnant. And I think in that moment, everything just shifted for me. Like my whole entire life, I was like, yes, I can finally get out of the job that was like
Mhm.
toxic. I wanted to be a stay-at-home mom. And, in my mind, the way that we grew up as a family, like me as a child, like my parents were always there. So I wanted to be that person for my children too. I wanted to be the mom that was always there, the mom that was like, didn't miss any of the milestone moments. And so, yeah, my whole entire future went there in like a split second. And I think it wasn't a week later, but it was like the following week we were booked in for the ultrasound. And they said, you know, they were looking around for a while and I thought nothing of it. Mm. Because my cousin had told me, she's like, "Oh, sometimes, if they can't find the baby, like, through an ultrasound on the top, they'll do an internal and, they'll see it." He couldn't find it through a normal ultrasound, so he went and told me to obviously empty my bladder and do an internal. At that point, he was still searching, and then he said, I'm sorry, there's no heartbeat." And the whole entire room just it was just like a deafening silence. It was almost like like all the sound had been taken out of the world, and the room just got smaller, and I just turned into my husband and cried. Like, I didn't even know that was my worst nightmare until I was living it. Like, it wasn't even on my radar.
Yeah.
Nothing I'd ever been exposed to because, my mum didn't experience pregnancy loss. So this was the first encounter that I had with, losing a baby. And, I had been telling everyone that I was pregnant in the weeks leading up to that. So it was really sort of heartbreaking to know that I was telling people that I was pregnant, but I had already lost it at that point, and I was kicking myself.
Yeah.
So I was like, I should have known. I was its mom. I should have known, and I should have done better. But yeah, it was just, I think that was one of the hardest things for me to wrap my head around.
Mm.
And then obviously I replayed every single day over probably that, 2-week, 3-week period, trying to figure out what I did wrong,
Yeah.
what I did to contribute to me losing my baby, what I personally did. And yeah, I was blaming myself. Obviously I knew I was grieving. So I allowed myself to go through the motions. I allowed myself to go through you know, the feelings of anger and stuff. But I think the blame was one of the hardest things as well. Like, I just felt like it was everything that me as a person, me as a woman, I
Yeah.
had done all of that wrong because that was my body's job.
Yeah.
Like my body had one job and it couldn't even do that right.
Yeah.
So yeah, there was a lot of attacking myself.
Yeah. So interesting, isn't it? Because has a different story on
Mm,
how it all took place, but there are some things that are so similar. And I think there are these threads, right, of like blame and guilt and shame and all of these things. So, how did that experience change you?
mm. It changed everything about me, but I didn't resist it. I just let it happen because as much as I wanted to be the person before my loss, the person that didn't know about pregnancy loss, the person that didn't have to go through that experience, I did. I went through it and I'm like,
Mhm.
I can't be that person anymore. I can't, you know, I'm only hurting myself even more by trying to be that person and trying to fit that mold that I used to be.
Right.
So it shifted everything. It changed who I was, but it also like my identity, like who I identified as. And then, but it also was beautiful in a way because I could choose my life again. I really got clear on what I stood for.
Mm.
Um, what I would allow into my life. And I ended up, I was a chronic people pleaser before my life.
Mm.
Um, I was bending over backwards for people that wouldn't do it for me.
Yeah.
And then I was getting hurt because then, my so-called friends would be doing stuff without me. And I was like, well, why do I have to be the person that feels like I'm holding everyone together? And then
Yeah.
if I choose not to do something, they seem to have lived their life. They're living a life without me. And I was like, why do I keep doing this to myself? Why do I keep trying to, please people that are toxic for me?
Yeah.
Why was I putting myself back into a work environment that was toxic for
Mhm.
me? And then I was
Mhm.
like, I wonder if my work environment was causing, and that actually was one of my things, did my work environment cause my miscarriage? Because it was
Mhm.
so stressful and I was getting, it was kind of mentally abusive because you just, with everything that was kind of happening, I loved what I did. I
Mhm.
loved, because I was a dental nurse, I loved
Mm.
being there for the patients and supporting them through a vulnerable time.
Yeah.
And that's where I started to actually believe my gift was, but it wasn't with them. It wasn't at the dental surgery. So I was like, why am I putting myself back there?
Yeah.
Why am I allowing people into my life that right for me? And it literally made me go through my entire life with a fine tooth comb and figure out what was actually serving me and what didn't.
Yeah.
So, yeah, it shifted everything, and it also did help me kind of uncover what I felt like what I was here on earth to do. I knew I had a bigger purpose. My dad died when I was 19, and I had a lot of people reaching out to me at that point asking how I navigated that, how, naturally I felt like I was helping people by
Yeah.
just allowing them to, or either I was listening to them or they could ask me questions and I was, helping them with what I had gone through and what I realized for my own journey. But I mean, I never thought that this was experiencing a pregnancy loss was going to be what the catalyst for everything that I did after that. But I believe it helped me become clearer what
Yes.
my bigger purpose was.
Yeah. I loved when you said that you were a dental nurse and that you loved helping people in a really vulnerable, hard time. And isn't it beautiful that that's exactly what you are doing now?
Yeah. Yeah, and
And
it's
because of your experience, like, it's
Mhm.
amazing how your life just handed that right to you. That clarity just came through.
Yeah. I I got a letter off a patient because she had severe anxiety when she came into the dental surgery, and she was having almost a panic attack just thinking about having to go in. And I just sat with her and I'm like, "It's fine. It's normal. Like, what you're feeling is absolutely
Yeah.
valid. There's someone in your personal space and you feel like you can't get up and walk away." Especially once they start,
Yeah.
because once they start, there's really no turning back. And I'm like, "I get it."
Yeah.
Like, so and she ended up writing a letter to the surgery and saying that I was an asset to the surgery
Oh.
and how I supported her, and I kept the letter, but I showed the letter to my boss at the time, and he's like, "Oh, that's nice." And I was like, "Yeah, okay, this is not."
Yeah. Right, because yeah, because that is a really personal thing. It's in your personal space on your body, and you You need someone that has more compassion than that.
Yeah, and I had, like, obviously, I thought that letter was huge,
Beautiful. Oh my
and
gosh, yes.
so for me to get it, I kind of just focused on that then. I was like, "You know what? My why I'm here on earth has more to do with this letter than
Mm,
where I was," and I wasn't going to let the idea of I had to be in a full-time job to survive,
mhm.
because essentially that was my mentality beforehand. It was like, "I have to be here because
Yeah.
otherwise we can't pay the mortgage and we can't live a life that obviously is when, you're not struggling. So, I have to be here and I've got to put up
Mhm.
with this environment."
Mhm.
Um, but yeah, then after the miscarriage, that was like completely shifted everything. And then and then my mind went back to the letter and I was like, okay, there's a gift that I have here. And I was already doing it.
Yeah.
So it felt almost like a natural transition to be able to use my experience then in an area that when I was going through my own healing and recovery, I realized there was not enough support. There was
Yeah.
not enough people that could offer that understanding and go, you know what? I get it. I get what you're going through. There was a lot of people reading from textbooks and going, okay, this is grief. You're grieving. And I'm like, no, this is different. Like, it's grief, but you blame yourself.
Yeah.
Like that, you can't, that's not in a textbook. Like, there has to be someone out there that can have that lived experience that can then have that knowledge in how to guide and support someone else out of that space, out of that darkness, because there is a beautiful life on the other side. But when you're in that darkness, you can't see that.
Yes. When you were
And
just talking, it made me think too, like, when we're in that season, when we're right, going through it initially, the people that we look to for help are usually either medical professionals
Mm,
who probably haven't experienced this themselves firsthand, or our close family and friends who also
mm,
probably haven't experienced, and they don't want to see us in pain.
mm.
So, yeah, the importance of finding someone like you said that can say, "Yes, I can relate to this. I know where you're coming from," is really vital in that time.
Yeah. And the medical system can be so dismissive. And that's where a lot of those feelings of, no one's there for me or it is my fault can get cemented in you because they don't actually acknowledge anything else. They don't acknowledge that, you know, you're an individual and this is how you're navigating it. You need this specific support,
Yeah.
someone to sit down with you and just say, either if they are a medical professional, they don't have to have been through it, but just to show that empathy and compassion
Yes.
in that moment rather than dismiss it and go like completely ignore either the experience or the emotions that are coming up because that's our first, you know, touch point with,
Yeah.
how the rest of the world's going to perceive it.
Yep.
And then we're like, well, if the doctors didn't acknowledge me, so why would anyone else? Like, why
Right.
would,
Right.
and then you end up getting that from society, like,
Yeah.
because then society is so
Like,
conditioned.
you just feel like it's so invalidated because you can't find the people who do understand this.
Mm.
How did you develop the practitioner program, and what is it all about?
Yeah, so I I started off supporting lost mums because I was like, well, obviously I needed that support. So I needed to create something that I was looking for, essentially. And what I did was I literally I stripped away well, I broke my healing down into like 3 sort of key transitional phases that I went through. And that's what I started guiding, supporting other lost mums through. And it was really transformative for them in a way that they were able to obviously be seen and validated at every point, but also receive the tools that they could walk away with and the support in between each session that
Mhm.
they needed. Because obviously, like, what's so different with therapy is like you get this one session, and then what I was finding for myself anyway was then I'd walk away, and in the week or 2 weeks before my next session, I'd spiral out of control and I had no support. So I was like, until I could get back into my therapist's office. And then I was back at square one. It felt like nearly every time because I was like, I've got nothing. There's no support, no tools, no nothing to support me outside of these sessions.
Yeah.
So I created ways that would allow them to heal themselves on the
Mhm.
outside. And there were essentially tools that I used that I found worked, or yeah, that I found worked for me. And I kind of went through, I was supporting women through that for a period of time. And then I had women reaching out to me because obviously there's no real support. And women that have had lived experiences with pregnancy loss, infant loss, child loss, wanting to support women through, the experience that those women had been through. They're like, I want to know that I can confidently talk to a woman and be able to guide her past that, guide her through that. And initially I said no. Initially I was like, no, no, don't have anything for you. I'm so I don't know how to do this. I don't know how to create this. Like, so I said no initially. And then I'd say probably another 3 months after that, one of the same women that reached out the first time, she's like, Sharna, do you have something for me yet?
Yeah.
And then having a couple more women reach out at that point as well. I'm like, okay, universe, this is obviously a sign that I have to do something. And so what I did was I kind of stripped it down a little bit more to a point where I could teach
Mhm.
what I did without obviously having all of my personal stuff in there. I kind of stripped it back to a point where I was like, okay, they get the education
Mhm.
of those 3 transitional stages and through healing and recovery. They get all the tools that I created from the initial program that I created, plus more that I had obviously developed over like the year or year and a bit that I was sort of offering my coaching. And I just started offering it. I was like, well, clearly, if women are reaching out to me, not wanting to know how to be that support for someone else,
Yes.
then there are more women again that want to know how to do that as well. And I've had women tell me there's no program out there that teaches you how to become a I say pregnancy loss practitioner because I feel like pregnancy loss can encompass so many different experiences. I have women in there who have gone through multiple losses, infant loss, termination for medical reasons. Like, I have women in there from all different experiences. Women in there who haven't been able to have children after losses. And so what the program offers is a core foundation in understanding how these women are navigating that time. And then the women, obviously, with all their different experiences, can add their level of understanding and their lived experience to what it is then they offer and tailoring it to different loss experiences. And yeah, I had women reaching out to me saying they've searched tertiary education places, universities, and they're like, there's nothing. Like,
There's something. Mm-mm.
so like you're the only one that actually trains you to be that type of person.
Yeah.
And the depth of what I go into is so different. I've got a bereavement doula in there that said just the level of sort of the bereavement side that I go into, she goes, it's so much deeper than what she had been exposed to prior. So, it's just, I guess it's my take on my healing and recovery, but I also dive really deep into certain areas that I believe is really, really important and I guess foundational in someone's healing and recovery.
It's so amazing, isn't it, that there are other women that want to help women who are grieving, and and that they're looking for just the right thing to help them. It's so that's so comforting, I guess, in itself that there are these women that are willing to do that. And then I have to think the experience that you gain just being able to talk to so many different women who've had such different experiences. It's gotta be really so interesting to hear everyone's story.
Yeah, because I essentially created, obviously, the program out of my experience.
Mhm.
So when they're asking me and challenging me on my program, but they're challenging me from their own experience, from what they're navigating, from potentially their triggers, and I'm just like, it's just so I love it
Yeah.
because it makes me grow as a person, and it also allows me to grow the program as well because then I can offer next sort of a layer of understanding because then I'm able to support them through what they're navigating. And because it is a different experience, they're obviously receiving the information in a different way.
Mhm.
So they often apologize. They're like, I'm sorry I'm being so difficult. And I'm like, no, I love it because
Yeah.
I want you to challenge me. I want you to ask questions. I want you to, because I know then that at that point, you're going to gain so much more out of it too,
Yeah.
because
Yeah.
it's not just a course. It's not just information that's kind of going in. It's not just from a textbook. Like it's interactive and
Mhm.
you can ask questions and be able to receive different people's also views from their own experiences and how they took the information and how they've been able to apply it to their experience. So, yeah, it's, you know, I mean, I love it. I
It
love being exposed to
yeah.
that.
So when they graduate from your program, they're a pregnancy loss practitioner. And then what do they do with that? What have you seen your students do after they graduate?
So I have a couple that have kind of coaching businesses, like so they offer coaching packages through their business, similar to essentially how I started with offering my services
Yeah.
to support them through like grief, support them navigating all of those areas in their life because loss affects every single area of your life.
Mm.
And even when you don't think it's affected by that part of your life, it often stems back to something to do with your loss and something to do with that trauma. So A couple of them have sort of created coaching packages. I've had one lady start grief circles in the
Mm.
UK. So she started to offer support circles, and they have just taken off. Like, she
Wow.
was so surprised at how many women were putting their hand up for support. One woman is a counselor, so she's going to add pregnancy loss into her counseling services. Another woman, she has graduated, she hasn't started any offerings just yet, but we will be working together in creating that for her and how she can start to bring all of that together. But she experienced um, infant loss and also a termination. So she's got a lot of different areas that she kind of really wants to bring awareness and support to. But yeah, it's just incredible.
Mm.
I've brought in guest experts into the program as well, and I had one of the guest experts, she does retreats. So one of the students is like, "Oh my gosh, like I wanna do retreats. I need to do retreats." Like, so offering pregnancy loss retreats.
Oh.
Yeah, so
I think it's important too to say, like, you also teach them the business side of it, right? You also teach them how to create a business doing this work, which is really helpful.
yeah, so the 4th pillar, I guess, to the business so to the program is the business
Mm.
foundations. And because I want women that have come through the program to at least have something to walk away with in terms of how they could maybe integrate that knowledge into something that they already have existing, or create something from scratch, like create a business, an offering from scratch. So I want them to be able to, obviously, the first 3 pillars of the program is my sort of recovery. I call it the pregnancy loss recovery method because essentially that was my transitions in my healing. And then the 4th pillar is business foundations because obviously you have the information, but then you're like, well, now what do I do? Now, how do I apply it? So I give them a pillar of kind of like free content where they don't have to pay them for, like, I guess, a business mentorship if they don't want to. They can take that information and then they can start implementing it and applying it, seeing what works. And then obviously, if they need deeper support, then we can do that together. But yeah, they can get a lot of free sort of foundational knowledge
Yeah.
as part of the program. And that can really set them up and send them on their way without having to sort of, yeah, invest thousands more into, a mentorship. And
Mhm.
um, they can just start implementing and start helping and supporting someone straight away.
I think what strikes me overall is it's just such a beautiful way to honor your baby, right? And to
Mm.
honor this experience that you've gone through, that I've gone through, that we've all any lost mama has gone through. And
Mm.
I do think there is a period of time where you just think, I want to do something meaningful with this experience. So I love that you saw the opportunity and just started creating what you knew worked for you and
Mm.
shared it with others.
Yeah. I believe that I often thank my angel baby for
Mm,
shifting the trajectory of my life.
yeah.
It as much as a, like, heart-breaking experience that it was, I, uh, I often thank I don't know if it was a boy or a girl, but I often thank him or her. And, I I was actually corrected a little while ago because I was apologizing to them. I'm like, "I'm so sorry that I wasn't there for you more. I'm sorry I haven't spoken to you. I'm sorry, that I don't connect with you more." And I had a chat with a clairvoyant, and she's like, "They don't they don't know time. Like, don't apologize, just have a chat."
Mhm.
So, when I do remember, I kinda just look up at the sky and I have a chat, and I just say whatever's on my heart at the time, and I'm now thanking them for being a part of my life,
Mhm.
because that short period of time that I had was enough to change everything for me. And now what I can provide is a place where women can remember and honor their baby. They can create something from that pain and help guide and support others that are navigating that time, even if it hasn't been their experience, but they'll have the knowledge that they can then guide and support someone else that's going through that and help that person heal and remember their baby and know that it's okay to talk about them and know that it's okay to feel the feelings. And, you know, I think that's one of the biggest things, is to be able to talk about your baby and to be able to remember them without someone saying, "Oh, no, you can't," or shutting you down for feeling the way that you're feeling. So I think by creating more support, it's giving women more permission to be in that, to experience their story, to talk about their baby, to remember and honor them.
And in turn, that does help them heal in a better
Yeah,
way. Yeah.
yeah.
Well, thank you so much for sharing your story and talking more about the ways that you are able to help others. It's just such a great ripple effect and that you've started, and I think it's just gonna get bigger for you, so I'm excited to see what's next for you, but where can everybody find information about what you do and more about the Pregnancy Loss Practitioner Program?
Yeah, so I believe my Instagram is an extension of me, of what I teach. My And essentially what I teach is what I value. It's what I've grown through and what I've realized for my own self and my own journey. Um, so you can find me at the Institute of Healing underscore PL, or you can go to my website. So it's just www.sharnasouthan.com, and sort of everything that I've created is on there as well.
There.
But yeah, I do hope that this ripple effect does start to gain momentum and really start making the big changes that I can see,
Yeah.
that I envision is going to happen.
It's so needed. It's so, so needed. There is not nearly enough support, so I
Mhm.
think it will, but I will definitely link all of your information in the show notes so that it's easy for anyone to find. And Sharna, thank you so much, my friend. I'm so happy that you spent this time with me today, and I look forward to many more times talking with you.
Thank you so much for having me. I appreciate it.